little follow-up segment for those of you guys that were following along yesterday in the stories. Topic of conversation. Let me just turn this up a little bit. There we go. Yesterday was autoimmune conditions. So one thing I was commenting on yesterday is that I have never seen so many positive ANAs and more autoimmune conditions in my clinical practice, more so than after 2020. So it kind of poses the question, why? Why are people developing lupus and rheumatic arthritis and Sjogren's and mixed connective tissue disease or some form of, scleroderma? One of the things that's known in the research is natural. Am I still not saying it? I don't know, right? C19. I guess I'm just going to still go with that. And both natural C19 and the V. So there's a lot of medical literature out there to support this. I'm happy to send any article. I would also encourage, if you're interested to learn more, like truly a deep dive, PubMed, Publications of Medicine, has tons of articles all about this general concept of autoimmune conditions post natural C19 and the V. So my speculation is such that when we are sick with anything, and this isn't necessarily new to C19, it's kind of a general concept that could happen. Any infection, viral, parasitic, bacterial, anything, right? Any microbe that we get has the potential to create dysfunction in the host. So if I'm the host, I'm the person, I'm the vessel, I'm the vehicle, I am at risk to develop an infection, as we all are, right? We're all exposed. I know people at the time were like, oh, I hope I don't get it, but everybody was going to get it. It's not a matter of if you get it, it's a matter of what happens to you when you get it. That's more important, is what happens to the person when they're exposed. How do they handle information? How does their genetic component respond? What is the natural state of their body baseline? Are they already inflamed? Do they have any other comorbid conditions or other things that could make it harder for them to deal with the immune activation? But I would definitely recommend step one, if you're interested, dive into PubMed. You literally can type in autoimmune conditions post C19, autoimmune conditions after 2020. There's a ton of research. It's quite clinical. It's quite interesting. It's very, very sciencey. So I don't expect you, if you're interested, to follow every piece of it. But the gist of it is such that exposure, microbe, and then it confuses the immune system. So rather than your immune system saying A, B, C, D, E, F, G, as it should, it's now going A, B, C, D, 19, 21, 75. It gets confused. How do you test for this? So a lot of people yesterday in the comment in my story were asking, well, how do you measure autoimmunity? You actually can measure some blood work findings. That's a start place. Really, we look at clinical symptoms and say, hey, is there something more going on here? You have a lot of muscle pain. You have a lot of joint pain. Maybe you have fevers that don't make sense. Maybe you've got swollen glands that are not really making sense with when you have not been sick. General malaise, right? Feeling kind of like, I guess the way people describe immune issues, if I could comment, and certainly if you've dealt with one or dealing with one, feel free to leave some comments below. But I think most people would describe it almost like a hangover, where everything hurts, things that you didn't know could hurt, right? Like a lot of pain. Not all of them can be associated with pain, which confuses people even more, because a lot of patients say, I have no pain. I don't feel anything. How come I have an autoimmune condition? I feel zero. Good. Best case scenario is your body says, we're not going to let you know. Worst case scenario is your body says, we're not going to let you know, right? It's kind of important to know so that you can manage and deal and work on it. But definitely PubMed has some really detailed articles if you're interested to dive down the rabbit hole. There's a lot of speculation. Basically, in the research, what we're finding is that the inflammatory cascade that is associated with COVID is harming the cells. It's harming the mitochondria of the host. So it's kind of like this room. Imagine that we're in this room, and this room is the cell. And Now the room is no longer structurally sound. I've got holes in my walls and my floorboards. I've got my windows open. The lights are flickering. The integrity of the room, aka the cell, is not functioning appropriately. And if you can't have great structural or physiologic responses, everything goes haywire. The biggest part of the mechanism is inflammatory cascade. So things like prostaglandins and cytokines. Imagine this. Imagine I'm a glitter balloon and I pop glitter, and all that glitter is inflammation. So cytokines, tissue necrosis factor alpha, interleukin 1, all of these pro-inflammatory cytokines, which are harmful to the cell, are kind of at the core of what long C is. Long C19. I'm still saying that because I don't know what's still being flagged or not. So that's the mechanism. You have to get down to the roots of working on what's causing it. So it's kind of like describing rats in the room as well. Imagine I have rats in the room. I can't just kill the rats, right? I can't just get rid of the rats that are in the room. I also have to consider what damage did the rats do to the room? How did the rats change my room? They ate through my walls. They ate through stuff. That's the aftermath. So it's not just about the infection of C19. That's mechanism 1. Mechanism 2 is what did it do to the person? So no, there's no storm today. The snowstorm passed. That would be mechanism 1, right? Imagine the snowstorm's the infection. Now we're dealing with the aftermath of the snow. There's ice everywhere. It's a mess everywhere. That is what long C is. Now, the ANA concept is such that you can measure autoimmunity in the blood. There are times that ANA shows up positive. That's definitely step 1. So if you're like, I don't know, do I have an autoimmune condition? Let me just say this clear as day. It is not standard of care. If you said, well, I did blood work with my primary doctor, I can guarantee you have not done an ANA. I would be shocked. I would be shocked. I would be shocked in a good way if your doctor ordered it. So you have to actually get specialty testing. The traditional people that look at stuff like this, maybe it could be like a rheumatologist, or if the person says, I've kind of gone down the rabbit hole, my primary is not really giving me answers, like where else could I go? Usually this is stuff that's found kind of after. It's not standard of care. You are not getting this done in your basic CBC. You're not getting this done on your basic CMP. You're not getting this done with your cholesterol. You're not getting the ANA with a traditional panel. So you have to request it if you suspect that there's reason to look, right? We need clinical reason to say, I don't feel good, something's not adding up. Then the ANA is step 1. Yes or no, you have it or you don't. It is a black or white yes or no, okay? The next part is a pattern. So the blood work will show a specific pattern. When they look under the microscope, they look at how the cells are kind of aligned. When they do some staining and kind of put everything like structurally under the microscope, the patterns are all different. The patterns represent different conditions. It's like looking at animals and saying that animal is pink and furry and makes an oinky noise. What do we call that, right? That pattern is associated with a pig. This pattern is associated with something different. So the patterns in the blood work can tell us what are we dealing with? What kind of autoimmune condition? What named condition is it? That's also going to be part of that. That's not a separate panel you have to ask for. That's just part of the ANA panel. It naturally will tell us if something is wrong. The blood will say, this is what it is. Okay, so you don't have to like specify that. But I definitely encourage to get this stuff looked at because autoimmune conditions can make people not feel good. Why do we care? Why do we care? What's the big to-do? The big to-do is such that if you don't know you have dysfunction, you can have a lot of symptoms that can look like hormonal imbalances. You can have symptoms that can look kind of waxy and waning. Autoimmune conditions are called the great mimicker because they look like everything. They look like I've got back pain. It looks like I've got joint pain. It looks like I've got headaches. It looks like I'm tired all the time. It looks like it could be mold. It looks like anything. So to say, hey, that's not the mechanism, or hey, that is, we need to know, right? We need to order that stuff. So definitely get tested for autoimmune conditions. Now, the next video, which we're not going to really dive into today because it's quite clinical, is what do you do? What do you do with this, right? What do you do? Traditionally, medicine may attempt to decrease the immune system's activation by immune modulatory drugs, which may or may not be applicable depending on the person, What functional tends to look to do is really try to recalibrate the immune system. So to go back to A, B, C, D, E, F, G. And that comes from gut health. That comes from decreasing the inflammatory cascade. That comes from getting rid of pathogenic load. If the person's still dealing with a virus, an infection, that has to be cleared. If the person's living in, for example, mold trips the wire and creates immune distress. It doesn't necessarily have to cause autoimmune conditions, but it can create immune concerns. Okay. So really autoimmune conditions are such that we're exposed to some trigger, potentially pathogenic, a microbe. It's one possibility. And it creates a confused body. So I look like I'm attacking myself. But that attack actually was driven by something outside of the body. So it's not really, oh, my own cells are confused. No. They're often responding to something. They're confused for a reason. So I do think that it's worth noting to get tested absolutely for autoimmune conditions. ANA panel. It will give you a numerical titer, meaning measure how big is the storm. It will give you the actual pattern. It will tell you, yes, you do, no, you don't. If you do, then that's where treatment comes in to say, well, what am I doing to help support this? Autoimmune conditions have to be supported because they tend to create even more damage. The likelihood of developing one and then it turning into something else is quite high. I don't know the percentage offhand, but it's quite high. So if the person says, well, I have rheumatoid arthritis, the likelihood to develop something else that is not rheumatic is quite high. I want to say greater than 40%. So it's kind of like an oil spill that when there's dysfunction in one place, it starts to create dysfunction in other places. That's kind of the mechanism. So get tested. Like I said, I know patients in my clinical practice who I've known prior to 2020. Maybe I've known them from 2015 or 16 or 17. I know their blood work. I've looked at it. They have no history, no family history, no previous history when I've ordered it. Now fast forward to 2020 and beyond, why is there a massive influx in autoimmune conditions? So we know in the medical research, natural C and also vaccine-induced C are causing some issues with the immune system. So just want to share that. Hopefully it was a little bit helpful. I know you guys had a lot of questions about like testing for it. How do you know? Blood work, biochemistry. You can request really any test. I always encourage that ask your doctor, speak with your provider, ask if they think it's clinically necessary. If you think it's clinically necessary, request it, right? There's nothing wrong with saying, hey doc, I'd really feel better if I kind of cross this off the books. It is not true that the genetic has to be there in order to develop autoimmune condition. Genes absolutely play a role. A lot of patients, especially when I explain this to them, are quite, I wouldn't say confused, but are looking for the one answer. What is the one thing that caused my autoimmune condition? It is not one. It is not one. Research would say it's environmental triggers. It is chemical stress, physical stress, emotional stress. It is viruses, pathogens, microbes. It's your own immune system, right? Like, what do I have? What do I not have in my own machinery? Maybe my gallbladder's been removed. That predisposes the person to pick up other infections from food. Now I go to eat my salad that has salmonella on it or Shigella or, I don't know, E. coli, and I don't have my gallbladder. Let's pretend I do, but let's pretend I didn't. Now I'm allowing that pathogen in, right? So now I have stress in the body. I've allowed a foreign invader to come into my body and create a mess. It all matters. So we look at host, environment, where are you spending time? Is it moldy? Is there water damage? What genetic component do you have? I do not subscribe at all to just because someone had it, you will too. Mom had it, so I will too. Dad had it, so that's why I have it. Not necessarily. Genes are certainly modulated. Genes are certainly altered. Genes can be activated or inactivated depending on their environment. I think it's a very passive viewpoint to say, well, that's why I have it. So there's nothing I can do because it's genetic, right? No. There are things you can do. There is a boundary there too. Within reason, there are things that you can't change. My eye color is my eye color. Yeah, I could cheat and wear contacts, but most of what we're describing is activated or turned on, especially autoimmune conditions. A lot of patients you're not born with this stuff. You know, you're not born with something like this. There are certain ones that people are born with, absolutely. But the people that I'm referring to are people that say, I never had this until. I've lived 35 years. I've lived 40 years. I've never had issues until. That's what I'm trying to work on, is if you could turn it on and create dysfunction, can you uncreate dysfunction? Yeah. If I could make something a mess, can I like clean it up? Yes. Okay. And that's the stuff that we look at trying to work on. So hopefully that clarifies and answers some questions around yesterday's little chat box in the story around autoimmune conditions. I would love to hear too from you guys in the comments if you know what I'm referring to. Some people say, I know exactly what you're referring to. I know the blood work. I've had it done. These are conversations I've been having with my doctor, because it's quite common. So I would suspect that more and more people are saying, yes, I've been tested. I've been dealing with said thing after C19. I think there's this notion that after C19, long COVID is the only issue. What is long COVID? It's a general description of inflammation, problems, dysfunctional patterns. Could that dysfunction create an autoimmune condition? Yes. Okay, so many things could happen after an infection. Many things. And the more research that comes out, I'm talking 2022 articles, 2023, there is so much more research saying that certain microbes and bugs are the culprit behind like even MS, right? Or Hashimoto's, right? Epstein-Barr has been linked to Hashimoto's, lupus. Epstein-Barr virus has been linked to rheumatic conditions, so rheumatoid arthritis, where people have inflammation in the joint. We name it something, right? We call it said thing, but it's really looking at, well, what's happening to the tissue at the microscopic level? What's happening cellularly? What's happening inside that cell that's causing a mess? Something's there. Something pathogenic tends to be trapped in the tissue. So hopefully that helps. I have to let you guys go. I will definitely comment more if you have questions, and if you have something to comment on that I missed regarding autoimmunity, certainly I think people's real lived experiences is certainly valuable. So if you're dealing with something like this, and you feel comfortable to share, leave some comments down below if applicable. And I'll see you guys in the next story, whatever it could be. Happy holidays. I'll see you guys soon. Bye now.